Welcome back, everybody. This Week in America on the Blue Funk Broadcasting Radio Network. Great to have you with us on the program today. Retired after decades in private practice, Dr. Byron Oberst has authored several acclaimed medical texts. He explores his medical life and family life in the new books, Reflections on Pediatric Medicine, 1943 to 2010. That's what we'll be talking about primarily in the program today, and a tale of a mother, her three boys, and their dog. With us on the program, Dr. Byron Oberst. Doctor, welcome to the program. Great to have you with us.
Thank you very much.
It is a fascinating book, and I'm sure a fascinating life. It had to be interesting when you went back and you were putting the book together, how far we've come in terms of medicine in the country. I mean, when you started the book basically back in 1943, well, as you're talking about those times, penicillin is just coming in. We're dealing with polio. What an amazing progress we've made in these decades.
Well, I consider that the golden age of medicine because all the new things that came about that changed everything for doctors. It was a marvelous time to be a part of it. And I'm one of the few people still above ground that lived through all that.
Well, you were a pioneer in so many areas that we'll talk about on the program. And I mentioned polio. Let's start talking about that because for so many people, we've heard about it. It was eradicated years ago. It's really not something that we spend a whole lot of time talking about. But in the book, Reflections on Pediatric Medicine from 1943 to 2010, you talk about that. And basically, and again, we're talking back in the 40s, the hospital literally filled with iron lungs and people, many who didn't make it because of polio because there was no vaccine at the time.
Right. See, it was 1952 was the horrible epidemic here in Nebraska. In our children's hospital, we had over 360 children through the season, and we used alcoves for beds, and we usually had between 12 to 15 iron lungs going all the time. It was a nightmare. Any time a child would get a bit of a headache or a little stiff neck or back pain, the family would go into orbit, and they sure was polio until proven otherwise. It was a nightmare.
How difficult was it being a doctor at that time and really not having that vaccine? I mean, what hope were you able to offer parents when they came in with their children, as you say, in a state of panic?
It was unbelievable. We practically lived in the hospital 24 hours a day. You had to because your patients were so sick, and when they started getting paralysis, you never knew where it was going to stop. And so I had this little 4-year-old girl, Pammy, that started with paralysis in her legs. The polio gradually went on up to almost her eyeballs before it stopped. She was in the iron lung for over a year. And every time you'd look at the parents, you'd see the anguish in their eyes and their hopelessness that was going on. Can't you do something more?
Well, you talk in the book Reflections on Pediatric Medicine, and available at Amazon. You can go there and put the information in and get the information on the book. Also, you can go to our website, thisweekinamerica.us, and we've got the link on there for Amazon. You talk about a young patient, Connie C., and she made it through this period, and you said that's when you first started realizing about faith and medicine.
Oh, my, yes.
And the power of prayer.
Without it, I couldn't be a doctor. You had to work hand in hand with the ministers, the priests, the rabbis, in order to bring people to believe in something so that they could handle their trials and tribulations. It was just a natural extension of what you had to do, especially in pediatrics.
Well, yeah, in dealing with that now, if there's a problem at birth, they go to the neonatal units and everything, and for the most part, is okay. We're making tremendous strides in that area. Back then, you didn't have that. You had to get these people through and rely on faith and prayer to be able to do that. A great story in the book about a patient that you had that you called Thumbelina and how you actually saw her all the way into healthy adulthood. Yes.
She was my second true miracle. Thumbelina weighed 1 pound, 2 ounces at birth. She would fit in the palm of my hand. She was a real 5 months gestation. She was one of twins that the other twin died immediately right after birth. Thumbelina had true grit, and she just wouldn't give up. And she was so immature that when I had the eye doctor look at her eyeballs to check her retinas, they hadn't even developed yet. And as she thrived, we went through the agonies of the damned with her. She would have convulsions from low calcium levels. She had low blood counts. She had everything. And then, as you'd expect, most all preemies that small would end up with some kind of a mental disability or cerebral palsy or some kind of a huge problem. She didn't have any of those things. She had trouble with her attention span when she got into school. We corrected that with Ritalin. I remember when she was in 4th grade, I told her, I always called her Thumbelina. I couldn't help myself. I said, Thumbelina, when you come in and have all A's on your report card, I'll give you the office visit free. Well, when she came in for 8th grade, her mother had a big smile on her face. She says, Thumbelina has a little message for you today. So I went in the examining room and said, well, Thumbelina, how you doing? She said, Dr. Oberst, do you remember what you told me in 4th grade? I said, yes, Thumbelina, I remember very well. Well, here's my report card. Look at it. Every one of them was our A's. I couldn't believe it. I had to sit down and squeeze her, and I probably got very sentimental and had some tears because I just never believed she would ever amount to anything.
You know, that has to be the joy of family practice, the fact that you're there with birth and you basically become a member of the family, don't you?
Oh, no question. You live with their hardships and their joys and their abilities, their celebrations, their births. You have a front row seat in life, really. That's the nice thing about pediatrics. You were involved. We usually, years ago, when we used to make house calls, before it became prohibitive from a cost standpoint, you'd sit around after you see the child, you'd sit around the kitchen and have a cup of tea or something and visit for a little bit. You got to know families real well.
Well, and that's interesting because in the book, Reflections on Pediatric Medicine, you talk about trying to strike that balance and how difficult that was. And when you opened the practice back in Omaha in the early 1950s, it's like, okay, I have to close the door to the office and then open the door to my home. And it was difficult, especially with 3 young children, a wife at home. Talk about juggling all that. And that's something you hear doctors even talking about today, especially in family practice, that, wow, I'm putting in 16, 18, 20 hours a day to the detriment of my family.
You know, medicine, it was such a seductive mistress that she could put her arms around you and you just forget about the world because there are so many exciting things to think and look at. But you could never carry that home. That was privacy, and that had to be left at the office. Then you walk in the door, and some of the boys always say, well, Dad, was this a good day or a bad day? If I said it was a bad day, boy, they scurried away. But, you know, I tried hard to make Fridays, which is my day off, to be their day. And whatever they wanted to do, and most of the time we ended up doing water skiing and then sailing on Sunday. So we tried to do that adage of the family that prays together stays together, and it worked for us pretty well. But I had a wonderful wife that made life that much easier for me.
Reflections on Pediatric Medicine from 1943 to 2010. And just think about the decades there and the progression of medicine. And it's a fascinating book. Also, another book written by the doctor, A Tale of a Mother, her 3 boys, and their dog. It's a fascinating story, and 3 rambunctious boys, as you'll find as you read the book. I mentioned before about some of the pioneering work that you've done, and you've been noted nationally, internationally for your work in RH blood transfusions and ADD. And this goes back before people were even talking about this. Let's talk about RH blood transfusions. What did you do there? What was the innovative?
If the mother was RH negative and the baby was positive, and she'd had several pregnancies, during the pregnancy, some of the baby's red blood cells would get into the mother's circulation where they didn't belong. And her body would produce antibodies which would come back across the placenta into the baby and create havoc, destroy the blood cells, create mental retardation, deafness, a whole group of things. And the only solution in those days was to be able to change the blood. You literally had to drain the crankcase and refill it with different blood. You had to use O-negative blood, which was fresh. And it was a very tedious procedure. It took about 3 hours to do. But, you had to watch a lot of parameters as far as the baby is concerned, their venous blood pressures and their heart rates, and give them calcium. And it was very intricate. It took about 3 hours to do it. But when it was all over, it was so gratifying because you saved a life and you saved a brain. And that in itself was very satisfying. And I did over 500 exchanges over my year. And then along came the pill. And with the pill, people didn't have as many pregnancies, so there wasn't as much sensitivity. So the RH problem became less and less. And then the ROGAM came in, and that neutralized the antibody, so it stopped the process right there. So if I tried to make a living on that, I'd starve to death.
Dr. Byron Oberst, our guest on the program, author of the book Reflections on Pediatric Medicine, also author of the book A Tale of a Mother, Her Three Boys, and Their Dog. Book's available at Amazon. Go to our website, thisweekinamerica.us, and you can get a link on there as well. Mention also your work in ADD, and I would say you're at the ground floor, but I'm not even sure we really even knew what it was back at that time. Talk about that.
Well, some children, let's start beginning. Any insult that happens to a baby or a child under about 3 years of age is apt to bother the electrical circuit of the brain. And if you have one neuron doesn't quite touch the next neuron in the brain, there's a little gap, and that gap is covered by a tissue fluid, which we call a neurotransmitter, meaning it transmits the electrical impulse from one neuron to the next one. And if that's bothered, then you don't get a good connection, so you don't have good attention span, and you can't write well, and you're clumsy, and a whole host of things. So our medications would come along and improve that connection, either by increasing the flow of the neurotransmitter, increasing the sensitivity of the end links so it didn't take so much time or so much of the material to do the job, or it kept it from breaking down so fast. So you could watch their progress. And to me, the most important exam their child ever had was his preschool exam, because at that point, if they went into school in step, they would do well. If they were in school out of step, they'd be out of step for a long time. And it was hard to get them back. And so you could tell at the preschool exam if they were clumsy on their feet, if they had trouble running with their fingers. You had them draw a man, good enough draw a man contest. And instead of having a stick man with all the eyes and ears and things, there would be an eye up here and a hand over here and something there, so they would be very aberrant. And you would begin to pick up very early those children who had distorted eye signals, and so with medications, you could change it around.
How much time were you able to spend with patients as you're talking about going through these tests and really understanding each patient as they come in? You read now that one of the problems that medicine faces, that doctors face, is the practicality of the business. We have to see so many patients, and you're actually maybe in the room making communication contact for a 7, 8, 10-minute period. How long were you able to spend with patients then?
Well, we set aside time for those. We took an hour for the first visit and half hours for subsequent follow-up visits, because they had to come back. They had to call me and report every 3 months. And then they had to come in and see me every 6 months. If not, I wouldn't take care of them. And I followed them, many of them, for years. Many of the boys grew up and became doctors or dentists or lawyers or whatever. And so there's an awful lot of gobbledygook around about that whole business, which I should have written a book back then, because all my stuff is gone now. But there's so many myths and not understanding. I think one of the worst things that ever happened to those children is that they had that philosophy. You put them on medication in the winter and off in the summer. There couldn't be anything more devastating to a child than to have his treatment program interrupted.
Now, it's fascinating, and I would love to have the doctor back, and maybe we can talk specifically about that, because you were there, like I mentioned, at the ground floor. The book is Reflections on Pediatric Medicine. Dr. Byron Oberst, our guest on the program, and rapidly running out of time. Now you have information coming at you from so many directions. If you're a doctor, you've got, of course, the internet. You've got people, drug representatives coming in, giving you information on a daily, maybe even an hourly basis, that type of thing. How difficult was it when you diagnosed somebody to get current information back in those early decades that you were practicing?
Well, from my standpoint, from the time I was an intern on, I spent an hour a day always studying medical journals. When I couldn't go to the library anymore, I brought my library home to me. I would take the 3 major pediatric journals, and then I subscribed to 3 audio tapes about pediatrics, so I'd listen to when I'd drive around town making hospital rounds. I'd go to a meeting outside of Omaha twice a year on selected areas where I wanted to learn more. So you had your own continuing education program, so that you could keep abreast of things if you worked at it. But that took time, and you had to figure out how to get the time. So sometimes days were rather short.
Well, a pioneer in the study, too, of time management, using computers, record keeping, that type of thing, and we'll talk about on future programs. Got about a minute left in this show. Interesting, your relationship with Warren Buffett, and I'm thinking about that. It's like, well, Buffett is from Omaha,
Oh,
and I
yes.
understand that you did have a relationship, and you had an opportunity at the ground floor to sort of invest when he's this young advisor out there, and you had a pass on it.
Yeah, I cry every time I think about it.
I'm sorry I had to bring it up.
But I took care of his family for about 15 years. He had 3 children, and his daughter Susie has a foundation that's done a great deal to help Omaha. She's very deep into early childhood education and that sort of thing. But they were a lovely family, and Warren got about 10 doctors together, and he said, "I'd like to have $10,000 from each one of you," when he first started up. And they were better off healed than I was. I didn't have anything, and so I had to pass on it. Well, now they're all multimillionaires. I'm sitting here in a retirement home, looking at life and enjoying it, but not having the lettuce that they all have.
Well, and you can look back, and you do in the book Reflections on Pediatric Medicine, what you've seen. And I talk about all the changes. You've really been at the ground floor on a number of these changes that we've seen in medicine over the decades. It's a fascinating book, Reflections on Pediatric Medicine, from 1943 to 2010. When the doctor's back, we'll talk some about the other book he's written, A Tale of a Mother, Her 3 Boys, and Their Dog, the love story of a father for his family. The books are available at Amazon. The book, again, Reflections on Pediatric Medicine, Dr. Byron Oberst. You go to our website and link on to Amazon and get information on the book. Doctor, thank you so much for joining us. Look forward to having you back on the program. Thank you for sharing some stories with us today.
My pleasure.
You're listening to This Week in America on the Blue Funk Broadcasting Radio Network.